Hi guys, James Moore again. Final one from me, just really reiterating, going to give you a bit more about the content of the course, the Sporting Hip and Groin. So the course is 50% lecture, 50% practical, where we're going to put a lot of emphasis on the practical, on the hands-on. We're going to get your hands in to palpate the groin, understand where all the different anatomical structures are and be very, very specific with all of those. We're going to be able to assess for adductor-related injuries, and how do you differentiate those with pubic joints? A hands-on assessment for pubic joint stress tests to adductor muscle injuries and adductor tendon injuries. We're going to look at abdominal related injuries and how do you differentiate between a rectus abdominis injury versus an internal or external oblique injury or sportsman's groin. And again, we'll differentiate those out with good hands-on practice. Finally, we'll be able to differentiate between hip joint injuries, whether it's intra-articular, i.e. labral tear, or periarticular. So which physical examinations do you need to do? Fadder's test, the Fabier's test, the Aber's test, and the Faber's test, all of which they sound very complex, but all of which help you to really differentiate out the hip. Equally, when we move to the practical, to the physical treatment day on the second day, we're going to be dealing with hands-on treatment to how to release the adductors to get effective movement, how to influence the abdominals, and how to mobilize the hip to get effective movement and restore normal function at the hip and groin. What are the key exercises for adductor related injuries? What are the key exercises for abdominal related injuries? How best can we functionally improve the rehabilitation around hip joint injuries? So very hands-on. There's probably about 3.5 hours worth of practical on the first day, and similarly 3 to 4 hours of practical on the second day. So you get a good 7-8 hours of practical hands-on delivery across 2 days. Many thanks. Look forward to seeing you then. Many thanks. Bye bye.